Good day, and thank you so much for attending our session today. I am Catherine Keogh. I'm a team lead in our claim services area at Workplace NL in the St. John's office. And with me today is Jennifer Grimes, who is a return to work facilitator in our Corner Brook office, and we'll be sharing this presentation today. So the title of our session is Return to Work. Getting Back is part of Getting Better. Just a reminder, if at any point during this presentation, if you need to stand up, move around, please feel free to do so. We want you to be as comfortable as possible. So just to go over our learning objectives for the day, throughout the presentation, you will notice we are going to be focusing on engagement. This is an important thing to consider in returning your employees to work following an injury. We will define what engagement is and ways to engage with your employees. We will briefly review some key things to include as part of your return to work program. We will explain the impacts of a work injury on the injured employee. Unless you've been in that person's shoes, you do not know what they are going through or experiencing. And a work injury impacts so many more things than just work, and we should never make assumptions as to what we think that person may be going through. We will highlight the role of engagement and ways this can occur throughout the return to work process. And then we will go through the return to work process from the time the injury happens till the person is back to work, and again, highlighting engagement throughout. And then we'll just be discussing some considerations around return to work. So before we get into the presentation, we thought we would start by showing a short video from our new campaign, Getting Back is Part of Getting Better. Just one second and I'll play this video.
It's more than just getting back to work. It's back to the usual. It's back to connecting with the people who care. Back to early morning huddles. Back to lunchtime surprises. It's back to what you can do, not what you can't. It's getting back to being you. Getting back is part of getting better.
Okay, so in the video I just showed you, they mention back to connecting with the people who care. And this is an important part of engagement in the workplace. Again, you will hear engagement mentioned throughout the presentation, as it is important for an employer to know whether your staff are engaged and the implications that this can have on an employee getting back to work. So you may be wondering, what is engagement? And it's present in a work environment where employees feel connected to their work and are motivated to do their job well. When it is present, you'll see things like I have listed here. Employee morale and motivation are high. There's good relationships at work. There's enhanced recruitment and retention of skilled employees. There's improved customer service and increased employee productivity. And some things that you'll see, I guess, occurring in these workplaces as well is that they're regularly seeking input from staff. There's good communication occurring, and there's no real secrecy going on. They do team get-togethers, and employees are recognized for their work. So when engagement is not present, obviously there's greater employee turnover. If employees are not happy, they may be actively looking for a new job. There could be loss of productivity because employees are just not working to their full potential and just not caring about their work. There's lack of team spirit. If those relationships with our coworkers are not good, then that is going to impact work and likely lead to turnover as well. And you tend to see punctuality and attendance just all over the place. People just aren't caring at all about any of that. And unfortunately, all of these ultimately are cost to the employer and cause employees to be unhappy at work. So you add disengagement with a workplace injury occurring, and you can quickly see how these things can impact whether or not someone returns to work, and obviously can cause barriers throughout that process. So ways to engage with your employees, you should make checking in with employees. It should just be a normal expectation. Like it's as simple as saying good morning when you come in each day, just, greeting staff. There should be open communication. So employees need to feel comfortable coming forward with any issues. You need to show your employees that you care. And if you have the opportunity to provide them some education, for example, on injury prevention, and I'll just use the example of repetitive strain injuries, maybe doing a session with staff so they can have some knowledge as to how to identify one of these conditions from starting to develop. The purpose of doing that is that they know when they need to let you know that they are starting to have some issues. And also they know that you as an employer want to see them well and not in discomfort while they're at work. And it also prevents the issue from developing into a workplace NL claim if identified early. You also want to recognize employee contributions. So, telling someone that they're doing a good job, I know this sounds really simple, but if you don't say it, the person is not going to know. So if someone goes above and beyond, just giving them recognition for that work that they've done. So just quickly jumping just to a quick overview of what a return to work program should entail. All employees should know that their employer values them as an employee, and if they should unfortunately have a work injury occur, that employer wants to see that person back to work as soon as possible following the injury, and will offer whatever meaningful work they are able to provide that person to reduce the financial impact of the work injury on that individual. As part of that process, you want to ensure you've given some thought as to who is going to be involved in the return to work process and educate those staff accordingly. Um, you want them to have regular contact with the employee. In a lot of workplaces, this role falls to the employee supervisor or manager, and those individuals, it needs to be explained to them how critical their role is in this whole process, and how important their interactions with that employee can basically make or break the return to work. If it's done well, it can definitely lead to return to work success. If it's done poorly, it can definitely cause the return to work to go off the rails. And I've actually met with employers in the past who have realized the importance of these roles in their return to work programs, and have actually developed in-house training programs for their supervisors and managers around return to work, and yeah, handle all that in-house, which is fantastic. Um, so give some thought as to what work you may have for your employees who have a work injury happen. So kind of planning for transitional duties before there's even been an injury occur. I mean, hopefully you never see an injury happen in your workplaces. But just, are there ways to modify the work? Can you cross-train employees? Is there any training that they can do as part of their recovery at work? Just give some thought to those sorts of things. And then once you've done the above, you want to educate your employees on the return to work process. So ideally doing a refresher once a year, with onboarding, providing that education to any new employees, but just ensuring that everyone is aware of sort of what the return to work process entails at your workplace. And clearly communicating who the employee should speak to once they have an injury happen, like that is 100% critical. They should know, there shouldn't be any question as to who's going to be following up with that individual if they have a work injury. And also giving some I guess, thought into job descriptions. Some organizations have a job description developed for every single one of their positions. Some organizations don't have any. So just kind of looking at maybe identifying a position that tends to see more injuries than others, start with that one, and then just gradually, just start picking away at the job descriptions. It is one of the first documents that we look for at Workplace NL to help guide the return to work process. So just giving some thought to that. So last year we developed a course on return to work, and I have some of the sample topics listed on the slide here. This course is geared towards small employers, but really any size employer or even your supervisors could do this course, as it does provide a good overview on return to work. Should you wish to avail of this course, it's available under the Certification Training Registry on our website. So the picture here, life before an injury, shows one of my favorite things to do, which is going on a hike. But we just wanted to paint a picture for you guys as to what life can look like before an injury actually happens. So we all take for granted, we get up in the morning, we go to work every day, and routine is a huge thing for a lot of people. So just think about your own routine each day. You get up, you get breakfast, you pack a lunch, grab your, Tim's coffee, you have a chat with a coworker, and the video I showed earlier actually highlights a lot of these things in that video. But we all manage our household. We have to clean, unfortunately, not a part that I like doing. We get the kids to activities in school. We do home maintenance like snow clearing, mowing the grass, raking leaves. And then socially, we go out with friends. We do activities with work friends or work social events. Maybe you have grandchildren that you try and spend some time with throughout the week. And then we also have our extracurricular activities like playing sports, going for a hike, riding skidoo or ATV, going moose hunting. And from a financial perspective, we're able to provide for our families. And also looking at our mental health, work is a big component of people being mentally well. And for most people, prior to a work injury, obviously, we're generally in good mental health. So overall, life is pretty good for most of us. So now you go to work one day and unfortunately sustain a work injury. Life can now change drastically depending on how serious the injury is and whether you are able to continue working or not. So now life as we know it, based on what I just described to you, can be turned upside down due to a work injury. And that injury could be quite serious and involve a lengthy recovery. So just thinking back just to the slide I showed a couple slides ago there could be an impact on every single part of that person's life, depending on the severity of the injury. And just kind of thinking about engagement again, as soon as that injury occurs, there immediately should be empathy from the employer. So calling the employee to see how they're doing, and the employee should be expecting this call. Like when you educated them on the return to work program, they should know that a supervisor or manager or HR is going to be reaching out to them to see how they're doing. Like the person shouldn't be getting their back up that somebody from work is calling them to see how they're doing. And they have enough going on with regards to dealing with the work injury that really they shouldn't be put under further stress trying to figure out the process and what paperwork they need to fill out. All of this should be had been previously explained to them, but it also should be given to them very promptly if they did have any questions very shortly following the injury. And it should be a genuine response from the employer that they care about the employee and that you're there to help them through this, unfortunate event. So what starts the process? Is the employee going to their healthcare provider? This could be a physician, a nurse practitioner, a physio, or a chiro. And that individual will basically either make the connection that what the person has going on is related to something they did at work, or there was a specific event that happened at work. They fill that form out and it comes into Workplace NL. And the next form that would then come in is the Form 7. So if we receive that piece of medical, that Form 7 has to be submitted by the employer, and that's regardless whether or not the employee is going to file a Form 6 or not. We do need to receive that. And you just want to ensure that you've filled that all in correctly. We do recommend that you fill it out on Connect, which is our online services for employers. And that will just ensure that if you tick a certain box, it's going to make sure that you fill in the appropriate information depending upon how you're answering certain questions. And because if the form is filled out incorrectly, it can delay the adjudication of the claim. And you do have an injured employee that is obviously awaiting benefits and wants their claim adjudicated in a timely manner. So the quicker that we can get that form, definitely the better. And with regards to an employee who does need to send in a Form 6, because there is benefits they're looking for from us, we do encourage you to get your employees to fill out the Form 6 on the portal, which is at My Workplace NL. And again, it just ensures the form is complete. There's no errors. We're at about 30% now uptake on Form 6s coming through the portal. So we're obviously looking to increase this number and get a better uptake on this. Um, and if that isn't an option for you, you can also print a Form 6, like fill it out with the employee, because some people find that form a little bit difficult to complete. So whatever assistance you can give to the employee, the better. And basically, once we have all three of those forms and they're complete, the claim will then move to our entitlement department. And as I mentioned earlier, the quicker that we can get all that information, the better, and the quicker the claim gets adjudicated. While the claim's being assembled, we are exploring whether the employee can return to work and identifying any barriers that may be impacting on that. And Jennifer will actually go over this in more detail in her part. So just to highlight, this is obviously the main section that an employer will see when the employee brings their copy of the form into you. And this is the same section on a form from a physician, from a physio, chiro, nurse practitioners actually fill out the physician's form. So this box basically gives you the functional abilities for the employee, and obviously it's the most important piece of information to you as the employer to figure out if you can get the person back to work or not. So I'm just going to highlight a couple of things on this form. So if any of the restrictions are ticked, so as an example, if lifting is identified, they've got that first box ticked, they really need to indicate whether it's a 10-pound lifting restriction, 20 pounds. Like by checking that box and just saying the person has a lifting restriction, you really need more information as to kind of what it is you need to do with that. I recommend speaking to the employee. Obviously, they had the appointment with their physician, so they can probably provide some clarity on what that restriction may be. If they can't provide it, then you may need to touch base with the case manager at Workplace NL, and they can help clarify that for you. So that's with regards to any of those limitations that get selected there. And the same would go for what are the recommended work hours. If that's ticked other, they do need to identify a certain number of hours. And again, you could get it from the employee. And if not, touch base with the case manager at Workplace NL. Should the hours be graduated? If that's ticked yes, that basically gives you the ability between yourself and the employee to progress that return to work without that individual needing to go back to their healthcare provider. So if they start at 4 hours, you can basically progress them as they're tolerating things back to their full hours and full duties. On the bottom, it says estimate duration of current functional abilities. This is essentially when the next doctor's appointment will be occurring. So if the 8 to 14 day box is ticked, they basically should have a doctor's appointment within the next 2 weeks. So I always recommend, if you haven't seen a form in 2 weeks' time, like just touching base with the employee to see, did they actually have their doctor's appointment and kind of when you can be provided with that form. So the whole reason the employee, when they go to their doctor, there's 3 copies of the form. So the top copy comes into Workplace NL, and the employee gets a yellow copy and a blue copy. The yellow copy is the employer's copy, and the main reason that they're given that is to bring that into the employer and for there to be that communication ongoing between the two parties about return to work and just seeing how things are going overall. So you don't want to miss this step, and you want to stress to your employees how important that is, that there is time available for you to have a conversation when they bring that form in. If you're tied up or they're busy at that point in time, just have them kind of touch base later on, either pop back or schedule a time to meet with that employee. But yeah, it's super important for you to have that conversation each time you get the yellow copy. And you also want to be chatting with them about any concerns, that they may be having, and that, to let the employee know that you're anxious to have them back in some capacity. So with so many people not having doctors these days and just finding it hard, if they do have a doctor, it's hard to get an appointment. And that goes for most of the healthcare providers. I just thought I'd point out that if an employee and an employer can agree on job duties, so either it's based on the functional information that's on the form, or maybe you don't have any functional information from the physician. If the two parties can agree on duties that that individual can do, the return to work can start. We don't require physician clearance on our end for that to proceed. So as long as you're both in agreement, you can start the return to work. If either party is not in agreement, that's when you would need to touch base with the case manager or the return to work facilitator to get clarification, from the healthcare provider. And if you, as the employer, have modified duties available, the first person that you should be discussing that with is the injured employee. We still have employers that will call us at Workplace NL and say, yeah, we have these modified duties available. The employee has not been contacted. So very important that you reach out to that injured employee first, because they will tend to get their back up if they feel that they have not been involved in that process and kind of things are just going on all around them, but they haven't been involved. And I also just want to quickly point out that we are doing education with med school students when they're in their second year of med school. We actually just completed a session with them in August of this year. The sessions are great. I'm actually a part of those and love doing them. So some of the things that we go over is how to fill out the forms properly, the importance of return to work. We go over accommodation, and we also go over some common occupational diseases that they might see in their practices. And just as I guess, a last point on this form, I just wanted to mention that specialists do not fill out Workplace NL forms. They basically dictate a report that comes into us as well as to the person's family doctor. So you aren't going to be getting those yellow copies of the forms. So it's very important to be in touch with the case manager at Workplace NL on those kinds of claims, as well as the employee. Again, you're going to be having the return to work discussions, but just making that employee aware that you don't get anything, obviously, from a specialist because you're not entitled to the medical information. But maybe just asking the employee to get a note from the specialist when they see them with regards to whether or not they're cleared to come back to work in any capacity. And our case managers also write the specialist to get specific information that we may need. And if there is no function noted and you aren't getting anywhere by discussing return to work with the employee, then I would recommend reaching out to a return to work facilitator like Jennifer or a case manager and let them know what work you have available for the employee, and they will follow up with the healthcare provider. I'm going to actually hand things over to Jennifer now, and she's going to go into more detail around the return to work process.
Thank you, Catherine. So as the return to work facilitator, I'll touch more on the return to work portion, starting with the early intervention process. As the employer, you should be reviewing return to work options right from the date of injury. You do not need to wait for a claim to be accepted to proceed with early and safe return to work. The worker should be consulted on possible return to work options right away. If both parties agree, like Catherine just mentioned, early and safe return to work can proceed. You do not need a medical clearance from a healthcare provider for early and safe return to work to start. If you happen to receive an MD form indicating off work with no function, and you have early and safe return to work to offer your employee, a return to work facilitator can be involved to discuss the early and safe return to work options with the healthcare provider that provided the MD form with no function indicated. So make sure you're also receiving your MD forms because valuable time can get lost when this does not occur. Immediate access to healthcare. Injured workers can self-refer to physio or chiro. A lot of injured workers don't realize this, but a physiotherapist or chiropractor can be their main healthcare provider. A referral is not necessary from a doctor. If a worker would like to see a physiotherapist or a chiropractor, Workplace NL will pay for 11 sessions of physio and 15 sessions with a chiropractor while a claim is with intake pending a decision. If the claim happens to get denied, the PO is canceled, the sessions end, and the worker is not required to pay those sessions back. So connecting a worker with a physiotherapist or a chiropractor early on should give us immediate function and treatment and should help also connect the worker with a healthcare provider. During the early intervention process, involvement from the return to work facilitator generally happens right away with the employer. The return to work facilitator takes the lead on making contact with the employer and the healthcare provider on initiating return to work discussions. regardless of the functional information provided on the MD report. If you happen to require assistance for early and safe return to work, a facilitator can be involved right away to assist as soon as the claim is registered. You do not need to wait for the claim to be accepted to have a facilitator involved. But in order for a claim to be registered, we need the Form 6, the Form 7, and a piece of medical on file for the claim to be registered. Once it's registered, a facilitator can then be involved with you to assist with the return to work process. If there's no function provided on the MD forms, our objective is to get function from the healthcare provider. Employers are to be contacted right away by facilitators for all opportunities for early and safe return to work. Return to work facilitators can also discuss with the case manager of a possible referral for an occupational therapist if a return to work cannot be arranged. So who may contact you from Workplace NL? Especially in the early stages of the forms coming into Workplace NL, there's several different staff members that you may hear from for various reasons. Claims registration. This is the area where the claims information is put together to send to our entitlement department. They may call you to verify information on forms and reach out to you if there's anything missing information. So like I said earlier, we need 3 pieces of information in order to register a claim, and that's the Form 6, the Form 7, and a piece of medical. Once those 3 pieces of information are received by claims registration, the claim gets registered, there's a claim number, and then the claim is distributed into intake and most likely assigned to a return to facilitator. When the claim gets to intake, the intake adjudicator is the person who decides if the claim will be accepted or not. They may have to reach out to get additional information, such as clarifying job duties on repetitive strain claims and or witness information. The return to work facilitator will reach out to explore what return to work options may be available, as well as obtain job description information or information about the pre-injury job. A return to work facilitator can be involved with the return to work process before a decision is made on the claim. A lot of times, the return to work facilitator can work with the employer and the employee and the healthcare provider and have people connected back to work in early and safe return to work before a decision is even made on a claim. The case managers, their role, they may be involved before adjudication if there's cooperation issues, but if not, they will eventually manage the claim if the claim gets accepted by intake. Early and safe return to work. So early and safe return to work is a program to assist injured workers back to their pre-injury duties while undergoing medical treatment. Getting back is part of getting better. Early and safe return to work is meant to be temporary, progressive, and rehabilitative. With the temporary part, it's not meant to be a permanent accommodation when we start someone in early and safe return to work. We should look at the pre-injury job first, and the goal of early and safe return to work is to progress to the pre-injury job. The hours, the duties, and the recovery all should increase with time to make it progressive. And rehabilitative, the worker can do active rehab in the workplace. The worker can be involved in a return to work program while recovering in the workplace by doing early and safe return to work. Early and safe return to work should be a self-reliant model between the worker and the employer, which goes back to engagement and involving the worker in the process and ensuring that they're familiar with the process before they ever have a work injury occur. So here's some pictures to look at. These pictures are basically showing us what life can look like after a work injury. We have to remember and realize how a workplace injury can really affect someone's life, not just at work, but at home and in their personal lives. We should not make assumptions as to how you think the person's life has been impacted. Again, you need to communicate with the employee and ask them how they're doing. So the first picture basically shows not much has changed. The employee is still able to continue with most of the regular activities at home and at work. The second picture, it shows the employee is able to return to work, either doing modified duties or an ease back, may have some impact on the regular activities at home. And the last picture is showing there's a big impact from the injury. They're not able to be accommodated at work, and the injury is having a major impact at home. They're not able to play with their kids do the regular maintenance, their hobbies, lack of routine, and sometimes this can stumble and affect their mental health as well. Some considerations for recovery at work. Submitting paperwork as soon as possible. So that's very important because all paperwork should be submitted to Workplace NL as soon as a workplace injury occurs or when we are aware of the injury. You should provide your worker with the Form 6 or advise them they can use the workers portal to complete their Form 6. Like Catherine mentioned earlier, delays in adjudication can occur if all the paperwork has not been submitted because then the claim won't be registered. A claim is not registered until all 3 pieces have been received, which is the Form 6, Form 7, and a piece of medical. Initial discussions regarding return to work should be with employees. Many times employers will forward modified duties to the case manager or the return to work facilitator, and the employee is not aware of them. As Catherine mentioned earlier, the employee should be the first one who's contacted to discuss early and safe return to work and give impact on what they feel they can do. This person knows the job the best as they work at it. They know what their function is, they know what the restrictions are. So the employer should be contacting the worker to discuss, these are your duties, do you feel you can do these things? It could be a circumstance where the employee then agrees to come back to work. To get buy-in from your employee, it's important to not miss this step. Return to work should be explored as soon as possible. Some employers think they need to wait for us at Workplace NL to accept the claim before starting early and safe return to work. However, that's not the case. The early and safe return to work process should start right from the date of injury. If you can keep your employee at work or offer modified duties, this should be offered as soon as possible. Ensure you're receiving the MD forms and stress the importance of the employees reporting their injuries to you as soon as possible. Valuable time gets lost when this does not occur. The non-reporting of injuries sometimes occurs in workplaces where there's disengagement, and the employer finds out about the workplace injury when Workplace NL calls looking for that Form 7. You should also know when your employee's next healthcare appointment is, so you'll know when to expect your next update. Because when you get your next update, then you can review that MD form for the function to see if their function changed, to then explore for early and safe return to work options again, or to progress their early and safe return to work duties or maybe hours. You can also contact the return to work facilitator if needed to discuss the early and safe return to work options to provide any assistance required. The early and safe return to work facilitator can also call the healthcare providers to advise of the early and safe return to work duties you have to offer. Because a lot of times employees are going to the doctor, advising them what their job is, and the doctor feels they can't do that job. But a lot of times they're not aware that there's reduced hours, reduced duties, or even alternate work that this worker could do in your workplace. So if the healthcare provider is not aware, then the facilitator can assist you with that to reach out to that healthcare provider and explain what is available for that worker that they can probably do within their functional abilities. Ongoing communication with employees. Employees should know who they have to drop those MD forms to. There should be time then when they drop it to have a quick chat with the employee regarding their functional abilities. You don't want someone coming in to drop off their forms during lunchtime or putting the form under the door. If you're busy when they do happen to come in, make a point of scheduling a quick phone call or a meeting with them to follow up to discuss how they're doing, to review the MD form, and to talk about early and safe return to work options. All coworkers, especially the supervisors, should be aware of someone returning to work in early and safe return to work. They should know the worker's hours of work, what their duties are, what they're performing, along with the restrictions. This will make for a successful return to work for all parties involved. Job descriptions, they're very important to have already developed on hand to ensure there's clarity as to what the employee's pre-injury job entails. It's important to have either a job description or submit a list of essential duties to Workplace NL when you submit your Form 7. If your company currently has no job descriptions, you could start developing these now. I'd recommend you starting with the positions that you see the most workplace injuries in. You should pick away at them until you have all your positions completed. The job description also helps identify what duties workers may be able to do in early and safe return to work. You want to look at the pre-injury position first for early and safe return to work before you look at going to alternate duties. With alternate duties, you need to take the time to explain to your worker that the alternate work that you have identified is very meaningful work. The worker needs to feel important, that they're back to work and they're contributing at the work. So for example, at McDonald's, you could have someone coming back as a greeter, welcoming people to your restaurant, showing them where there's a free seat, showing them where the lineup is to. Another example is at a recycling depot. I've had people come in who couldn't do the lifting of that pre-injury job, but came in and started work at the front door to direct traffic to people where they need to go to. And this these type of alternate work is not meant to be a permanent accommodation. So it's to get the worker back, it's to get them connected, it's to retain their earnings. The worker also needs to understand the value they're adding to their job by doing this alternate work. If you're unsure what you might have available for early and safe return to work, contact us. The return to work facilitator and the case manager can also come to your workplace to do a site visit so they can see the work that goes on there. They may have suggestions regarding early and safe return to work. We also need to review the early and safe return to work plan with employees. The early and safe plan should be developed with the worker before early and safe return to work starts. So everyone is aware and on the same page and agrees on the expected hours and the duties that are going to be worked in early and safe return to work. The early and safe plan should be then submitted to Workplace NL on Connect. The return to work facilitator can provide education and assist completing the early and safe return to work plans. Early and safe return to work has different options and situations. So I'll just go through some of those right now. So modified job duties, that's changing the job duties of the pre-injury position required to accommodate the worker's functional abilities. For example, you're alternating or removing some of their duties. The worker is still primarily working in their pre-injury job. Job bundling could be grouping of multiple tasks from one or more positions. For example, it could be a nurse dispensing all medications on a floor instead of an individual staff doing it. Changing times of shifts, so day shift versus night shift, start time later in the day to reduce some of the heavy workloads. I see this a lot in nursing. Sometimes we have nurses start back in early and safe return to work working night shifts because it's a better option to start there because sometimes there's less job demands on nights. Provision of ergonomic equipment, that could be simple as using a sit-stand stool or using headsets, and on-the-job training for an alternate position. So this may involve cross-training we mentioned earlier. If done before an injury occurred, there will be no delay in starting the early and safe return to work. So the overview of OT services. With a more serious injury, we may need to get services from an occupational therapist to assess the worker to get objective function and determine what is safe for the worker to do. So some examples that an occupational therapist can provide to us at Workplace NL is WSOR. So WSOR is a worksite occupational rehab. This can be working with an occupational therapist or a physiotherapist. It's a highly structured, goal-oriented individual work program designed to improve and restore physical function to return to work to the pre-injury job. A progressive return to work plan is developed by the OT provider who visits the work site to assess the job demands, and then they develop an early and safe return to work plan for the worker and the employer to follow. CBOR is another program we have at Workplace NL that works closely with an occupational therapist. So CBOR is a clinic-based occupational rehab program that can be performed with an OT, an occupational therapist, or a physiotherapist. It's an intensive treatment program specifically designed to address an injured worker's physical capacity and function as it relates to their job demands. This program is usually utilized when early and safe return to work is not available or the worker is not job attached. It's a fairly expensive program, and ideally, we would prefer employees at work instead of simulation at a clinic. Another program that we have or that we use OT services are for functional assessments. So functional assessment can be done by an OT or a physio. A functional assessment is completed to determine a person's level of function and ability to perform their work. It can also determine if job modifications or restrictions are needed. These are most time completed. These are most times completed once an employee has medically plateaued and a permanent accommodation or labor market re-entry is being explored. So ways to engage following a work injury. Throughout the presentation, myself and Catherine has talked about and we have highlighted the importance of engagement. While one of your employees is off work due to an injury, consider some of the following to ensure the person knows they're still valued and keeps that connection while they're with their workplace. So some things are social events. Include staff who are off work. Please don't forget your staff who are off. Always include them in the social gatherings and get-togethers, no matter how long they've been off. You know, if the worker gets injured over the summer and it's still not connected back to work, December rolls around and you have a Christmas party, please include them. They need to still feel a part of the team, even though they were injured at work and cannot get back to that work because of the injury. The person is still a part of that team, and the more they are included in that team setting, the more value they feel. Stay in touch, the frequency and contact. Always check in with your employees to see how they're doing. So both parties need to communicate in early and safe return to work, the worker and the employer. So you as an employer should always be contacting your worker, even if you don't have contact from them. So just an example I'm going to give you right now. If an employee who was hospitalized because of their injury at work and no one contacted them, like no manager or supervisor called or visited them while they're in hospital, do you think that person is eager to return to work? No. They feel completely forgotten about and unimportant to their employer and their workplace. Here they are injured. It happened at work. They're in the hospital and no one's contacting them. So just think about that. We really need to keep communication, and you are obligated as an employer to communicate with your injured employee. You should also maintain a separate file for each injured worker. Keeping good documentation on file is very important, so you know exactly what the current status is for each employee. In turn, this leads to better communication with the individual. Some employers that we've seen have had one large file folder for every MD form from every employee who's ever been off work for the last several years. This can create a lot of confusion and can be a barrier for returning to work if you're not organized for each employee. Follow up with your staff after they have a full clearance. So as part of your return to work program, supervisors and managers should have regular check-ins with the employee who's returned from an injury to see how things are going. See if they have any minor issues that then you can hopefully catch it before and address it before it becomes a bigger issue. You can continue to do this for 3 to 6 months following the workplace injury. So here are some resources in case you would like more information on engagement. Hopefully you can now see the importance of engagement is how important engagement is before, during, and after an injury occurs. All workplace parties need to be engaged for a successful return to work. Employers should not make assumptions when there's a workplace injury. They should provide empathy to their employee and assist the worker by supporting them in any way possible. The return to work process should be much more successful if the employer is there to support their employee by regular communication, assisting with accessing healthcare providers, and discussing early and safe return to work as soon as possible. While an employee is waiting for a claim to be adjudicated, they don't receive any wage loss benefits from Workplace NL as we're waiting for a decision to be made. If the worker is connected in early and safe return to work, the employer pays the worker for the hours they work. So then they receive some monies. If they're in early and safe return to work, you know, for 4 days a week, 3 hours a day, then the employer pays them for the hours they work. Developing a return to work program or enhance an existing one. Ensure that supervisors understand how important their role is in early and safe return to work and their approach to the employee, how this can make or break the success for return to work. All supervisors should be trained to know the roles and responsibilities of early and safe return to work. If your workplace is unionized, make sure the employees are aware that they can have the union representative involved in the return to work process for the return to work planning. Communication. If you do nothing else, please have regular communication with your staff before, during, and after an injury occurs. The regular contact will ensure the employee feels valued at work and will also help reduce the barriers for returning to work. Involve the injured employee in the whole process. They are the key person in this process and also stand to have the biggest loss should things not go right. The impact on their work, their personal life, and financially. Ensure they're treated with empathy. Just think about it and put yourself in their shoes. Also, you can contact Workplace NL for any assistance required. If you're not sure who to contact, just call the main line at 778-1000 and they'll direct your call through to the appropriate person. Thank you so much for listening today. So if you have any questions, as this has been recorded, you can just email safety@workplacenl.ca and someone will get back to you.